Rahim. Let's talk about the histology of the liver. So this that you see here is basically a classic hepatic lobule. ठीक है, इसके अंदर ये वाला जो सेंट्रल स्ट्रक्चर है, दिस इज बेसिकली द सेंट्रल वेन. ठीक है, इसके बीच में जो रेस की फॉर्म में ये छोटे छोटे डॉट्स नज़र आ रहे हैं. ठीक है, दीज आर एक्चुअली द हेपैटिक कॉर्ड्स. इन हेपैटिक कॉर्ड्स के बीच में हमारे पास क्या होती हैं, हेपैटिक साइनसॉइड्स होती हैं. ठीक है, एंड एट एवरी कॉर्नर ऑफ द पेंटागन ये वाला जो एरिया होता है, ठीक है, दिस इज बेसिकली कॉल्ड एज द पोर्टल एरिया. ठीक है, समटाइम्स ऐसा भी हो सकता है कि आपकी जो पिक्चर है वो हाईली फोकस्ड ना हो. दिस इज ऑल्सो द हिस्टोलॉजी ऑफ द लिवर, बट दिस पिक्चर इज नॉट वेल फोकस्ड, सो यू कैन नॉट अप्रिशिएट द लॉब्यूल सो वेल. ठीक है, लेकिन आपको सेंट्रल वेन तो नज़र आ रही है, एंड यू कैन ऑल्सो सी द हेपैटिक कॉर्ड्स. Always remember that this portal area or the portal tract, it contains three structures. It contains a bile ductule, a branch of the hepatic artery, and a branch of the portal vein, which is called as the portal triad. This is the histological side of a gallbladder. इसके अंदर you can see multiple mucosal folds. ठीक है, and जो mucosal folds हैं, ठीक है, इसमें जो epithelium है that is of a columnar variety. Then it contains a lamina propria, which contains elastic fibers, collagen fibers, fenestrated capillaries, venules. ठीक है, but जो lamina propria that is simply devoid of glands. ठीक है, except in the neck region where simple tubulo-acinar glands are present which secrete mucus into the bile. And then you've got muscularis, which is basically a thick layer of dense connective tissue that contains large blood vessels, lymphatics and autonomic nerves. ठीक हो गया. और उसके बाद हमारे पास आ जाता है कुछ एरियाज़ में एडवेंटेशिया है. ठीक है, एंड द अटैच्ड that is there in the attached part of the gallbladder is having adventitia, whereas the non-attached surface of the gallbladder that is covered with visceral peritoneum that constitutes the serosa. So आपने 3 layers describe करनी है. Mucosa containing the epithelium simple columnar. फिर उसके बाद we have a layer of lamina propria that is fibromuscular. ठीक हो गया, which contains elastic and collagen fibers, and that contains blood vessels, venules, lymphocytes, plasma cells, but it is simply devoid of glands. There is absence of goblet cells and crypts of Leber-Cohen. ठीक है, and then we have muscularis that contains dense connective tissue. It does not contain smooth muscles. अच्छा, आई एम सॉरी, इन्होंने मस्कुलैरिस में बोला है कि बेसिकली द मस्कुलैरिस इज फाइब्रोमस्कुलर इन नेचर, मीनिंग इट कंटेन्स इंटरलेसिंग बंडल्स ऑफ स्मूथ मसल फाइबर्स along with collagenous and elastic fibers which are present between the bundles of smooth muscle fibers. This diagram shows the histology of the ureter, which has got a star-shaped lumen, and it is having transitional epithelium. Transitional epithelium is that is why also called as uroepithelium. ठीक है, इसमें आएगा lamina propria and there is no muscularis mucosae, and then there is an inner longitudinal and outer circular smooth muscles. These are I think the longitudinal ones, ये वाले, और ये जो लंबे लंबे नज़र आ रहे हैं, these are the circular smooth muscles. One clinical aspect that I wanted to mention about the gallbladder is that of Rokitansky-Askov sinuses. This is basically a condition in which the mucosa dips down into the muscularis externa, forming these sinuses, which is indicative of hyperplasia as a result of cholecystitis. This is the histological diagram of the pancreas. ठीक है, these that you see are actually the interlobular duct. These big structures are actually the pancreatic lobules, also called as the pancreatic acini, and in between these whitish structures are the islets of Langerhans. This is another histological diagram, inter or intralobular ducts and the pancreatic lobules. The islet of Langerhans are not clear in this picture, but you may see some whitish zones. These are definitely the islets of Langerhans. This is the histological slide of a human kidney. The upper zone is the cortex, which is highly saturated with multiple glomeruli. The glomeruli. And the zone that is beneath, that does not contain glomeruli, is a little less saturated, which is called as the medulla. So the main structures that are present in the cortex are the glomeruli, the convoluted tubules, and the medullary rays. Whereas in the medulla, that contains the renal pyramid, that contains the loop of Henle and the collecting tubules. Also focus on this picture, the cortex, and now moving towards the medulla. You can see multiple collecting ducts. This is the histological side of the urinary bladder. It also contains transitional epithelium or uroepithelium. In transitional epithelium, the basal layer is of cuboidal cells, and over the basal layer are present several layers of polygonal cells. And those polygonal cells, they form large dome-shaped cells, also called umbrella cells, whose highly convex apices bulge into the bladder cavity. Then it has a thick lamina propria, and it has 3 layers of muscularis externa. There is a longitudinal, a circular, and a longitudinal layer. These layers of smooth muscle constitute the detrusor, and these layers are not visibly visible. They are not visible separately. Rather, they are intermingled or intermixed. And the last layer is the adventitia, which consists of fibroelastic connective tissue. The superior surface of the bladder is covered by peritoneum or the serosa. This is the histological site of the parotid gland, which mainly contains serous acini.